Welcome to Consumer Times. Today we will talk about what is cancer, causes, prevention and treatment, its costs, everything you need to know about cancer, what it is, why it happens, how to reduce your risk, and how much treatment actually costs in India and abroad. A must-watch for every family. Namaskar, and a very warm welcome to Consumer Times, your trusted partner in making informed and safe choices every day. I am your host Dr. Arun Kumar. Today, it is scary as every 2 minutes, someone in India is diagnosed with cancer. Every 3 minutes, someone dies from it. Yet most of us know surprisingly little about this disease, what it actually is, what causes it, and most importantly, what we can do about it. Welcome to Consumer Times. Today, we break it all down for you. Our body is made up of trillions of cells. Normally, these cells grow, divide, and die in an orderly, controlled way. Cancer happens when something goes wrong in this process. Cells start multiplying uncontrollably and refuse to die when they should. This buildup forms a mass called a tumor. Not all tumors are dangerous. Benign tumors stay in one place and don't invade other tissue. But malignant tumors, that's cancer, can invade nearby tissue and spread to other parts of the body through the blood or lymphatic system. This spread is called metastasis, and it's what makes cancer life-threatening. Cancer is not one single disease. There are over 200 types, named after the organ or cell type where they originate. Breast cancer, lung cancer, oral cancer, cervical cancer, colorectal cancer, each behaves differently and requires different treatment. Cancer develops because of changes, called mutations, in the DNA inside our cells. These mutations can be triggered by many factors. Tobacco use is the single largest preventable cause of cancer globally. In India, where tobacco chewing is widespread, oral and throat cancers are among the most common. Smoking is directly linked to lung, throat, bladder, and kidney cancers. Unhealthy diet and obesity are increasingly linked to cancers of the breast, colon, and pancreas. Physical inactivity, excessive alcohol consumption, and processed food raise the risk significantly. Environmental and occupational exposure to chemicals, like asbestos, pesticide, or industrial solvents, can trigger cancers over time. Prolonged exposure to UV radiation from the sun causes skin cancer. Some viruses and infections directly cause cancer. HPV, the human papillomavirus, causes cervical cancer. Hepatitis B and C can lead to liver cancer. H. pylori bacteria can cause stomach cancer. Genetics also play a role. If multiple family members have had breast, ovarian, or colon cancer, your risk may be elevated due to inherited gene mutations like BRCA1 or BRCA2. Age is another factor. The longer we live, the more time our cells have to accumulate mutations. Here is the most empowering fact. According to the World Health Organization, 30 to 50% of all cancers can be prevented. That means nearly half of all cancer cases are within our control. Quit tobacco in every form. Cigarettes, bidis, gutka, pan masala, all of it. This single change is the most powerful step you can take. Eat a balanced diet rich in fruits, vegetables, and whole grains. Limit red meat, processed food, and sugary drinks. Maintain a healthy weight and stay physically active. Even 30 minutes of walking 5 days a week makes a real difference. Reduce alcohol. Limit or avoid it altogether. Protect yourself from the sun by using sunscreen and covering up during peak hours. Get vaccinated. The HPV vaccine protects against cervical cancer and is recommended for girls and boys before they become sexually active. The hepatitis B vaccine protects against liver cancer. Early detection is the most powerful tool we have after prevention. Many cancers, when caught early, have a survival rate above 90%. Get regular screenings, a pap smear for cervical cancer, mammography for breast cancer, colonoscopy after age 45, and blood tests that flag unusual markers. Do not wait for symptoms. By the time symptoms appear, cancer may already be in an advanced stage. Modern medicine offers several treatment approaches, often used in combination. Surgery removes the tumor from the body. Chemotherapy uses drugs to kill cancer cells or stop them from dividing. Radiation therapy uses high-energy rays to destroy cancer cells. Immunotherapy helps your own immune system recognize and attack cancer cells. Targeted therapy uses drugs designed to attack specific mutations in cancer cells. Hormone therapy blocks hormones that fuel certain cancers like breast or prostate cancer. Treatment choice depends on the type of cancer, its stage, the patient's overall health, and available resources. Let's talk money, because for most Indian families, cost is a real barrier. Treatment costs vary enormously depending on cancer type, stage, hospital, and city. In private hospitals, a single cycle of chemotherapy can range from 20,000 rupees to 2 lakh rupees. A full course of radiation therapy can cost 1.5 lakh rupees to 5 lakh rupees. Major surgery can run 1.5 lakh rupees to 8 lakh rupees or more. Immunotherapy, one of the newest treatment forms, can cost 2 lakh rupees to 6 lakh rupees per cycle. But here's what you must know: government hospitals like AIIMS, Tata Memorial in Mumbai, and regional cancer centers offer treatment at 50 to 70% lower costs. The quality of care is often comparable or even superior for specialized cases. The Ayushman Bharat Pradhan Mantri Jan Arogya Yojana scheme covers cancer treatment up to 5 lakh rupees per year for eligible families. CGHS covers government employees. Several states have their own cancer relief funds. NGOs like Can Support, Indian Cancer Society, and HCG Foundation offer financial aid, subsidized medicines, and free screening camps. Generic medicines are another major relief. Branded cancer drugs can cost 50,000 rupees a month. The same molecule in a generic form may cost 5,000 rupees to 10,000 rupees. Always ask your oncologist about generic alternatives available at Jan Aushadhi stores. Cancer is not a death sentence. With awareness, prevention, and early detection, millions of people survive and live full lives after a cancer diagnosis. Do not let fear stop you from getting checked. Do not let cost stop you from seeking help, because help exists. If this video helped you, share it with your family. It might be the most important share you ever make. Like, subscribe, and hit the bell icon so you never miss a Consumer Times update, and comment your views in comment section. We'll see you in the next one.